Hello, my name's David Patterson. I'm Director at UQ's Centre for Clinical Research. As you may know, we're launching a series of seminars here at UQ-CCR focusing on research very relevant to clinical topics. I'm here today with Dr. James Scott, who's a child and adolescent psychiatrist. James, I'd like to just start, you hear people say, oh, they're psychotic. What does psychotic actually really mean from a medical point of view?
So psychotic or psychosis is an umbrella term, and it refers to a mental illness where people have some sort of distortion in their ability to test reality. So by that, what it means is that people have psychosis, they've got symptoms like they're hearing noises or voices or music that other people can't hear. That's what we call hallucinations, or they're seeing things that other people can't see. Alternatively, they might have ideas which are false and fixed, absolutely unshakable. So they might believe, for example, that they're being pursued by the CIA and that there's they're in great danger and so forth. And everyone around them saying, look, there's nothing to worry about. You don't need to worry. So that's what we call delusions. Mm-hmm. So people with psychosis have hallucinations and or delusions, and that's what makes up this group of disorders which we label as psychotic or psychotic disorders.
Mm. So obviously healthy, normal children may have some delusions. I presume,
like Santa Claus.
Exactly. But I guess where you're more focused is in adolescents who, we all, I guess, know people who were tracking along beautifully and then had developed schizophrenia or bipolar affective disorder. What age do people start to get true psychosis?
Yeah. So the peak time of onset for illnesses like schizophrenia and bipolar disorder is between 15 and 30 years. It's slightly older for females, slightly younger for males. And we don't know why it comes on at this time. As you say, David, often these young people, they're growing up, they've got all these ambitions, everyone's got hopes for what they're going to do, and then all of a sudden they have this decline. Often the changes are subtle initially, it might be a change in mood and change in sleep and so forth, and then just with time the person's experiences become more and more odd and distressing, and we see that they then have enormous problems with their schooling or with their university studies or their work, and they become more isolated, and then perhaps they go on and start using drugs because they're trying to find ways to cope, and it really becomes a very, very disabling illness for many people. We know that when people get schizophrenia, about 1 in 100 young people get schizophrenia, so it's enormously common really, considering the severity of illness. And we know that whilst a portion of them do very well and recover very well, the majority don't. And this is why we're really seeking causes, trying to understand the causes for this illness and also better treatments for it.
So we've touched on schizophrenia and bipolar affective disorder, which may both have psychosis as part of their presentation. In the elderly, we sometimes see people with depression having some psychotic symptoms. Is that ever a feature of adolescents or young adults who have depression? Do they ever get psychotic symptoms?
Yep. So psychotic symptoms are just part of schizophrenia, part of bipolar disorder, and sometimes part of depression, anxiety. In fact, anyone can get psychosis if they're put under enough stress. So psychosis is related to excessive dopaminergic activity in the striatum in the brain, and so if people are under enormous stress, they get this upshoot or upregulation of dopaminergic activity, and that brings on psychosis. We see it in people who've been to war and put under enormous stress there. We see it when people are given medications or drugs that can increase dopaminergic activity. That can happen then. So when people get, you mentioned older people get depression, they get psychosis, it can happen at any age, but it's really a characteristic that can occur when people are under enormous distress. The difference between, say, depression or anxiety and some, odd beliefs or hearing voices and, say, schizophrenia is in schizophrenia, the psychosis is persistent. It continues on. It doesn't sort of go away after a few weeks. It goes for months and sometimes for years and years.
Now, in this seminar, you're going to talk about a specific cause of psychosis. Do you want to expand about that a little bit?
Yeah, so this is one of the most exciting pieces of research I've been involved in. About 10 years ago, a new syndrome was described, what they call NMDA receptor encephalitis or autoimmune encephalitis. And what was first described as a case series of 12 women who had psychosis and then went on to have a loss of consciousness, very, very ill, all identified as having these antibodies that their body had produced proteins which attacked the brain, attacked the NMDA receptors in the brain. Since then, there are a lot more cases described, and people started to see that actually these symptoms of psychosis, sometimes it doesn't progress beyond there. Sometimes people just have a psychosis and they end up in the mental health services. We very early on in 2011, 2012, we identified a couple of patients who had chronic psychosis who actually turned out to have this autoimmune condition. They didn't have schizophrenia, they actually had this autoimmune condition. When they were treated with immunotherapy, they recovered, they got better. So this led us to think, wow, I wonder how many people are getting admitted to our services at the moment who have this autoimmune condition and should be treated with immunotherapy rather than by psychiatry. So we established a study. It was the first one that was done in Australia and one of the few in the world where every person who got admitted to a hospital for psychosis in southeast Queensland was screened for this autoimmune condition. And over 15 months, we had 113 patients who were admitted with this first episode of psychosis, of which 6 end up having these antibodies, this immunological condition that caused the psychosis. 5 of these we treated with immunotherapy, all recovered. So really fantastic. So I've just been at the Schizophrenia International Research Conference and presented these findings, and people are just blown away by the fact that that the big question which everyone worries about is how many people have I got in my service that have this autoimmune condition that we haven't diagnosed, that we haven't treated yet. And so that's where our research is heading.
Amazing. So 2 obvious questions. Firstly, how you diagnose it and then how you treat it. So can you diagnose it on a blood test, or do you have to do special scans or lumbar punctures? How do you diagnose this?
So blood tests will pick up about 3 in 4 people with this illness. So for the majority of people, it can be diagnosed with a simple blood test. The blood test costs about $200 to do. There are, like all blood tests that screen, there are problems with some people who come out positive, they're false positives, and some people come out negative or not negative. So just doing the blood test sometimes not enough. Where there's a high degree of clinical suspicion that this condition might be there, they need a lumbar puncture as well to see if the antibodies are in the CSF and the spinal fluid. So that's the diagnosis. Scans don't help, EEGs don't help, so all the other things that often help us, they don't help with this condition. Treatment requires immunotherapy.
What do you mean by immunotherapy? Is that like steroids?
Yeah, like steroids, like methylprednisolone, intravenous immunoglobulin. So they're the first line treatments. And then the second line treatments can be using monoclonal antibodies such as rituximab, cyclophosphamide, other powerful immunosuppressant agents as a second line treatment.
Do they have the potential to cure this condition so a person would never have a psychotic episode again?
They do. There's still some debate. This condition's only been around 10 years, so we're still not quite sure about when you say you'll never have it again. We've only known the condition 10 years, so we don't know if they'll have it again or not. But most people appear it to be a monophasic illness. They have one episode, and if they recover, they don't tend to have it again. Mm-hmm. Some do have a relapsing, remitting course. And so we're not really at this stage, we're not clear whether people do recover fully and don't have any more problems, or whether they do have further episodes. One of the strengths of the study we did is we followed these people up for up to 4 years, and they've all remained well. So at this stage we can kind of say that they've recovered.
I mean, particularly when many of us grew up thinking people with serious psychotic illnesses may be disabled for the rest of their lives.
Yeah.
To imagine that some people are cured is just absolutely phenomenal. I guess it really leaves one final question. The other 95% of people with their first episode of a psychotic illness, could there be other treatable, curable causes out there that we just haven't discovered yet? What's your feeling about that?
Without a shadow of a doubt. I see schizophrenia, it's not one illness. It's going to be many, many different illnesses. Mm-hmm. And I would predict that we're going to identify them, one at a time, probably pick out 1%, 2%. Mm-hmm. And as we understand what the illness process is, and we can manage it better. And I think we'll be finding that as time goes on, we'll be able to sort of help many, many more people who are suffering of psychosis.
Amazing. Well, thank you so much for your attention, and thank you, Dr. Scott, for really a very eye-opening presentation. We look forward to your seminar.
Lovely.
Thanks very much.
Thank you.